Hey, thank you very much for being here today. My name is Toby McGrath. I am with Protect Our Care Maine, and we're here to talk today, as we all know, about the shutdown that has occurred and the dichotomy that is occurring within that shutdown, with Republicans wanting to give tax cuts to billionaires at the expense of health care and tax cuts for the ACA, the premium tax credit, along with Medicaid, Medicare cuts, trading in, tax cuts for billionaires for, middle-class tax cuts, essentially, and health care for people. We are looking at 1.5 million people who will lose their coverage, and the tax credits are not extended. These come up. And what we have here today is someone that actually is affected by this, who owns this establishment that we are in here right now, and started this, and because of the ACA was able to move forward years ago to do this. And so without further ado, it's my pleasure to introduce Briana Bononcini.
Thanks, Toby. Thank you, everyone. I'm Briana Bononcini, and this restaurant you're standing in today would not be possible without the Affordable Care Act. Without having affordable health care, my partner and I wouldn't have been able to leave our jobs to start a business and take that chance. We took the chance on building the restaurant because we knew we would have health care. This restaurant's also been able to let us employ over a dozen people through the years and create jobs here in Maine, and being part of the Maine small business economy and community. Striking out on your own to start a business is scary enough. The uncertainty you'll be able to make a living is almost paralyzing. But then you add the uncertainty of whether or not you have health care if something catastrophic happens is a whole other level of concern. And so without the Affordable Care Act, many people don't want to start small businesses. We wouldn't have started a small business without knowing that we did have that safety net of good and affordable health care for ourselves and our family. I work with and know many Mainers who would be unable to go to school, open new businesses, or care for family without the coverage through the Affordable Care Act. The largest barrier for entrepreneurs is health coverage, and good and affordable health coverage for them and their families. Far too many Maine families are worried about raising rates and deductibles, and now not even sure if they'll be able to afford health coverage. This shouldn't happen. I don't understand why President Trump and the Republicans have put tax cuts for corporations and billionaires over the premium tax credit for hardworking Americans and Mainers who are just trying to make a living and support their family and support their communities. Thank you for your time.
Thank you, Brianna. Thank you for sharing that story. Now it's my pleasure to introduce Congresswoman Pingree, who has always been a champion of health care, even as a state senator when she put in Maine RX, which was first in the nation dealing with prescription drugs. So this is nothing new to her. So it's my pleasure, Congresswoman Pingree.
Thank you. Thank you, Toby. That's a great memory going back to when the fight was about prescription drugs, which it still is every day. And thank you so much to Briana, and thank you to everyone here, your whole family, for opening up the restaurant. It's a beautiful place, and we love that you're doing this small business and that your story represents what so many Mainers have said, particularly Maine, which is a state of small businesses and self-employed. So the cuts to the Affordable Care Act premiums are going to be even more extreme in our state. So let's just talk a little bit about that and why this is such a big fight. The enhanced premium tax credits help more than 50,000 Mainers to afford their health insurance. So we have a whole variety of ways that people get coverage, some under Maine Care, some get their coverage through their jobs, but many of those who are self-employed, and we have a lot of them, fishermen, farmers, people who work in the woods, people who have their own businesses, who depend on this for affordable health care. And without these extended tax credits, they will be without coverage, largely because they'll be priced out of the marketplace. We all remember the time when there were insufficient ways to get your health insurance. That's why we passed the Affordable Care Act, and that's why we've made modifications like this. 9,500 Mainers are looking at losing their subsidies altogether. Some are looking at having them drastically reduced. Now, some people have said to us, like, why are you fighting about this now? This doesn't end until December 31st. But I've heard from numerous people in my district who have already gotten information from their insurance companies saying, here's how much your premiums are going to increase. Or they've gone on our calculator online to figure out exactly what those increases will look like. So those notices start going out officially from their insurance companies as of yesterday, October 1st. And by November 1st, they need to go on the exchange and make a decision about what to do. And with faced with those higher rates, some 2 times more, 3 times more, and I'm going to read you a couple of stories that we've gotten in, many of them going to drop their coverage or find that will be unaffordable for themselves and their families, and we will have many more people who are no longer in the pool. And we know what happens when people leave insurance coverage. It means that many people are uncovered. Hospitals have to deal with uncompensated care, and even if you get your insurance covered by your employer, your rates are going to go up as well. So everyone will be impacted by this. This is not just an issue for some people. When you couple it with what already happened in the big ugly bill, $1 trillion in cuts to Medicaid, which will affect Maine Care, which is going to affect our hospitals who are already closing unit after unit, cuts to Medicare, cuts to national NIH, cancer research, other important research, the CDC, public health. We are looking at a healthcare catastrophic problem that is likely to start kicking in by the end of the year and then go into next year. So we are very worried about all these things come together, and that's why we are drawing the line and standing our ground on these Affordable Care Act cuts. So I just want to read a couple of stories because, like Briana's, they really help you to understand in a much better way than I could ever explain exactly what people are going with, and we are happy to share these stories with you. I mean, I have pages of them just from putting out a little bit of a call to people and saying, tell us what you think is going to happen. Here's someone, Michael from Raymond, who says, my insurance costs are predicted to go up 2 times, meaning that premiums for my wife and I combined would be $2,086 per month for a silver plan. That is more than a mortgage payment and an absolutely absurd burden to place on a household. Not to mention that this is premium only before taking into account any deductible or copay, which are themselves enormous. Here's another one that I received from Yarmouth. I was forced to retire at 62 earlier this year from a job due to open heart surgery on March 2025, required because of a birth defect. Due to the physical nature of my job, I cannot return and started my reduced Social Security on April 2025. I received $34,000 a year on my Social Security, and I am currently on a COBRA of over $1,000 a month, which will also expire soon. I will be replying on Obamacare soon, as I am single and I am too young for Medicare. Please extend the health care subsidy so that I can afford it and continue my heart recovery. Here's another one from Cumberland. My wife and I are both self-employed, and we have health insurance through the Maine marketplace. That is that is the exchange in Maine. We currently pay $2,376 per month for health coverage for 2 of us and our 2 children. I was already informed by Harvard Pilgrim that my premiums will increase by 30% if the premium tax credits are allowed to expire at the end of the year. This will place our insurance premiums as the largest single monthly expense for my family, even more than our mortgage payment. So I have numerous of these. Some are people who are just saying my costs will go up $100 a month, but on my budget, $100 a month is too much. So it is all across the income spectrum. This will affect a tremendous number of Mainers. And as I said, coupled with the other cuts we're already facing that we know of already either been done by this administration illegally or that were passed in the big ugly bill, we know this is going to face a huge healthcare cliff that we're all going to have to be challenged with. So as you know, the federal government is in a shutdown right now. The Republicans have absolute power to change this. They control the House, the Senate, and the White House. They can change this in a minute as long as they agree to go along with these cuts that I know are going to impact their district just as much as ours. So again, I thank everyone for being here today. I'm happy to talk more about this, share any more stories with you, but just want you to know this is a really critical issue facing Mainers, and we're not going to back down.
All right, thank you. There's one other thing I wanted to note, which I forgot before, which was, when we're looking at this, Americans, individual, if you are making $63,000 or more, you won't get the tax credit anymore. It's not going to be, it's over with. You're not going to have health care. Also, family of 4, $129,000 or more, again, you're not going to have coverage on this exchange. So these are, serious numbers and seriously that affect Mainers. So with that said, though, just want to open up to any questions for anyone up here.
there another way of the Republican Party trying to just kill Obamacare at the end? Because they tried just to make it unaffordable.
Well, I mean, they have tried to repeal the Affordable Care Act many times. They seem to stop just doing the repeal votes, but this is one way to drive it into the ground to make it unaffordable for people and to make many more people in this country not covered. I don't understand what the argument is behind it, because I know for many of my Republican colleagues, they are just as concerned about how this will impact their districts. They're just afraid to fight back or speak up right now.
Can we talk briefly about the shutdown? We've heard a lot about the blame for the shutdown being on the Democrats. As you said, the Republicans control the House, the Senate, the White House, also Supreme Court, just everything in our government. So what is the fight about? Because as you said, they can move forward with this if they want. They have the numbers to do so.
So our sort of simple statement to them has been, save health care, repeal the cuts that will impact health care, and go along with the agreements you have already made. I mean, one of the challenges, I serve on the Appropriations Committee, is that we, in a bipartisan way, pass an appropriations bill every year. And this administration, even though there have been bills passed, no longer respects Congress' power of the purse and has illegally taken much of that money back. That's some of the money that should have gone to the National Institutes of Health for cancer research, or into public health, or the CDC. This money has been repealed. So we're just saying, keep your agreement. So we're willing to make a deal on these cuts and believe that they understand how important it is too, but we want them to keep their promises, not just say, oh yeah, we'll make a deal somewhere down the road. We'll do it when we get to it. And as I said, I can't emphasize it enough. I've been in the majority party before. You control the process. You control everything about it. And they control the House, the Senate, and the White House. Now, they're currently being blocked by some of the Democrats in the Senate, but that's because of the filibuster law. If they chose to, they could remove the filibuster. That's within their power, too. So for them to say, it's somebody else's fault, you don't get to do that when you're in charge. They just don't want to put their members in a position of having to vote against health care. They want to try to blame this on us or use some other excuse and say we're asking for something else. We're not. This is what we're asking for.
Are we seeing a rift from your perspective in the House of Representatives between Republicans who do want to move forward with this and some who are just like, I don't want this for my state, for my people that I am representing? Because I think people are trying to understand how there is a shutdown when they have said that they are all on board with the same things.
Yeah, it's an interesting issue. I mean, I've found this year, unfortunately, even many of the Republicans that I'm close to that always do good work, they're afraid to cross their leadership, or more importantly, they're afraid to cross Donald Trump in the White House. He immediately announces a primary against them or threatens their wife and their family. It's a brutal administration to work with, and many of them are not willing to cross them. So my guess is some of them don't want to vote the other way. They also did not bring the House back into session. It's the first time in my history of being in Congress that the whole House wasn't there until the lead up of the shutdown, which happened at midnight on Tuesday night. We were there Monday and Tuesday. We were originally scheduled to be in session, but they canceled it abruptly at the last minute. We came to town. We said, we're here to negotiate. They didn't even show up. So we don't know when we'll be called back. Right now, hopefully it will be someday next week. We should be back there tomorrow. We're off today because it's Yom Kippur. We normally would have taken this day off, but we could be back voting tomorrow if they called us in.
When I previously covered this, from my understanding, health care premiums could rise as much as $900. Is that, if these enhanced tax credits are not renewed, is that the same?
Did you say $900?
$900.
Oh yeah, it could raise thousands of dollars. I mean, I have the example of somebody here. Oh, if I could only find it off the top of my head, who's paying several hundred a month right now, but their premiums would go up $2,000 a month. So we've seen predictions, that on average they'll go up twice what people are currently paying. So that is with the people who are currently using this. But it will also impact everyone else, because as people leave the pool, and I guarantee you in November, if people are looking at these much higher prices, they will sadly just say, I don't have the money in my budget. Particularly younger people will say, younger people who it was important to get in the pool, to have more healthy people in the pool. That's how health insurance works. But many of them will say, hey, I just don't make enough at my job. I've got to drop coverage.
I'll have a few more. Previously, all throughout, whether it's state legislation, whether it's federal legislation, there's been this attack on Medicaid, Medicare, saying that there's waste, farm abuse, and also saying that there are people who are on Medicaid or Medicare who shouldn't be, and that the other option is the marketplace. You've seen the $1 trillion in cuts for Medicaid, Medicare. Now you're seeing these enhanced premiums where you're saying people will be priced out and won't be able to afford it. What are your thoughts there? Because the push has been the option is the marketplace, and that is now may not be a reachable option for many families, not just in Maine, but across the country.
Yeah, you're making a really good point, because under the cuts that they've already enacted to Medicaid, when those kick in, there will be many people in Maine who no longer qualify or can't keep up with the paperwork demands. I mean, one of the challenges is they've added all these paperwork demands where people have to prove every month that they're still working at their job. This was tried in Georgia. In Arkansas, it's already been dropped because it was so cumbersome. And in Maine, I'm particularly worried about this because we have so many people who work a variety of jobs, piece together their income, or they work in the woods, they go clamming, they do a variety of things where they don't get a computerized statement every month. So asking them to figure out how many hours did you work this month, if you don't qualify this month, you're off the plan. It's a very dangerous pathway, and it, in fact, impacts a certain number of people in our state. But the cuts are much broader than that. It will impact our seniors in nursing homes. Most people who go to assisted living or some kind of long-term care are dependent on Medicaid, and it will certainly impact our hospitals and the payments that they get. And you're right, if you get kicked off of it, the argument has been, well, just go onto the marketplace. But in fact, without these enhanced premiums, you won't be able to qualify there earlier either, or it will be, your premiums will be too high, and you just will say, well, that wasn't any good, I couldn't afford that either.
Can we talk briefly about the implications that this will create? I think people hear, oh, you won't be able to provide health care, and they think, oh, well, work harder, whatever. What are some other real, tangible results or impacts that we can see from this, where we have a crashing healthcare system because hospitals are not getting the rebates at the rate of care for Medicaid, Medicare, the $1 trillion cuts.
Right.
Multiple people who are going to be either priced out of the health insurance, or they make too much money to where they don't qualify for the Affordable Care Act anymore. What are some other implications other than just you'll lose health care?
Sure. Well, as you said, it's a multiple number of things going on with all the cuts from various places. And of course, one of our biggest concerns in Maine is the closure of hospitals. Waterville saw the closure of its hospital this week. They've just announced that they're also going to close their walk-in clinic. Many hospitals in Maine have had to close part of the hospitals, particularly maternity care. And we know we're a rural state. People already drive sometimes an hour and a half or more to get to a hospital. This will make that even worse. And if you're someone facing having a baby, you're already thinking about, can I even live in my town anymore? Am I close enough to care? Or if you're a stroke risk or if you have heart problems, you want to be close enough that you can get that care. So closure of hospitals and other kinds of healthcare clinics is a huge issue for people, but also general wellness. I mean, one of the reasons we fought so hard to get a new system of healthcare like the Affordable Care Act was to say people need to get preventative care. We're not a very healthy state. We're the oldest state in the nation. We have a lot of people who work hard, do physical work, and need to get preventative care. Go for their checkups. Make sure that they're doing cancer screenings, all the things that you do if you're able to go routinely. If you don't have health care coverage and you're worried about putting the food on the table, paying your housing costs, you're just going to say, well, I'll wait till I feel sick. That's true of younger people. Cancer rates for younger people are going up at a rapid rate. We want to make sure that everybody is getting that kind of care and coverage. So it absolutely will result in more people being sick, more people dying, but also an overall pool of sicker people, which adds the cost to everybody and brings up the cost of healthcare. So I think we're just going back in the wrong direction into a healthcare crisis of the Republicans' making. We've worked many years to build up many of these systems, and they're crashing right in front of us.
My last question to you, with knowing that and with seeing how these implications could increase death rates for a lot of different cohorts of people, pregnant women,
Yep.
older generations, younger people who may have health conditions or things that would require them to need to be at doctors more frequently. What are your thoughts there? How do you feel knowing that people you represent are being placed in this position, and there is not much that you, as a representative and a member of Congress, can do about it other than say, hey, pay attention to this?
Yeah, it makes me extremely angry. We've worked hard to fix many of these systems. They're not perfect, but they're way better than they used to be, and we just have to keep fighting back. For me, that is just standing our ground as a member of Congress and saying we're not going to put up with the Republicans continuing to do this, and we're certainly not going to let them do it in the dark of the night. I mean, one of the reasons we're trying to make sure that wonderful people like Briana will tell their story, that we're getting out more stories, that we're speaking to the press, and making sure our constituents know this is going to impact you. Even if you have good coverage right now, you may lose the hospital in your area. Your costs will go up. Everyone has a rate at which will be unaffordable, and maybe your employer will say, sorry, we just can't use healthcare coverage anymore. And I know a lot of small businesses who do the right thing and cover their employees and are struggling to do it are going to say, oh my goodness, the premiums are going up so much. How can we keep the business going, employ these people, and continue to cover their healthcare? So they're putting them in a difficult position. So we got to fight back for everybody, but we also have to make sure that everybody understands what's going on, because often this administration, what they will do is say, oh no, that's not us. We're not cutting your Medicaid and raising your premiums. Look over here. It's all about, something else. And they're always looking to some other diversion. And we have to make sure we're bringing people right back here and saying, no, this is real people, real businesses, and they're going to hurt our state dramatically.
I think you swear this is my last question. If I don't ask, I won't be a good reporter. We are seeing the redistricting of these states for the elections. How will Democrats fight back when elections come up? Is there a chance that there could be a turn of tide of flipping the majority? The Democrats have been criticized for not being as aggressive or not meeting Republicans where they are. There's been a lot of criticism about Democrats in Congress taking the high road instead of, again, meeting Republicans where they are. Where are we fighting back?
Well, we used to be very proud of saying, when they go low, we go high. Now, when we say when they go low, we just get in the fight with them, and we are doing that on every front. This fight over healthcare is one of the important fights where we have some leverage, and we're just going to keep fighting back. When it comes to redistricting, I've always been a big believer in fair redistricting and using fair standards. But when they did what they did in Texas and are doing it in every other state, I've been a strong supporter of saying to California, hey, if you can change the system, I'm sorry, I don't like the way we have to do this, but we got to fight back. Now, eventually, we should pass a federal law, and I've voted for one before, and I've supported the bill that says all states are required to do redistricting in a certain way so that we keep that fair. But we absolutely have to win back in that midterm election, because if we don't get some fighting power of the House or the Senate or both and being able to push back on this president, stop his bad cuts, do some investigations of the crazy things they're doing, we're going to really be failing the American people. So we're in the fight, and we're in the fight every day.
I have no more.
Okay. Well,
Are you worried about the viability of your business going forward?
Yeah, I am. And I'm worried about the viability of all small businesses who depend on the Affordable Care Act. And, there's so many people that I know that are even just one-person businesses starting in food. And we want to talk about the food community, talking about like food trucks or, caterers. And, they need that. And there have been actual times while we were on the ACA that had we not been on it, something like I had a issue with my pregnancy and had a $40,000 delivery for my daughter. And that was 6 months after we opened this business. Had we not been on the Affordable Care Act, we would have went bankrupt and the business would have shut down because we wouldn't have been able to afford to pay those medical bills. And so there have been, I've lived through it, actual business saving moments that this provides. And I think it's incredibly important that we support our community and make sure businesses thrive here in Maine.
Have you talked to other business restaurant owners around about this issue?
I have, yeah. It's a constant conversation.
How do you know about this? I mean, you're not just, we all represent each other.
Mm-hmm.
And there's this grand split in Congress with people with big money, big dollars. I mean, we're even seeing where there is, you mentioned prescriptions. We're seeing that there's a new prescription way to privatize prescription medication through the administration, which would, feed money directly into the president's hands. What are your thoughts here when you're seeing people who are supposed to represent people like you make these decisions on your behalf?
My thoughts is that they're not representing people like me, and they're not representing our state, and they're not representing our community when you are literally voting against the well-being of your constituents. And so they don't represent, and they're not doing their jobs, and I think they need to be out of jobs next year.
Is there anything that, what would it take to, in your eyes, to flip the script? I mean, we have representatives who, are fighting back from the people. Is there any improvements that you think could be done to, make them realize and see, hey?
I mean, I always think that people can do a lot. I'm the daughter of union workers, so I know how important unions can be in protecting workers and people. And so I think there's a lot that can be done. Like specifically, I don't have any grand idea, but
Any more? Are we all good? All
Thank
right.
you
Thank you
very
very
much.
much.